Good afternoon. I call to order the hearing of the Assembly Health Committee of July 7th. I want to make a couple first announcements. Make a couple of announcements and then get into our hearing on bills. First, we will hear 2 witnesses per side with a time limit of 3 minutes each on the bills. Additional witnesses, please state only your name and organization for the record and your position on the measure. On the consent calendar, we have the following bill proposed for consent. Item number 8, Bill SB 804. Author, it's the Health Committee bill. And removed from the calendar today, the following bills are removed from today's agenda per request from the author. Item number 1, SB 128, Senator Wolk. Item number 7, SN 746, Senator Wolk. So we're going to start with item number 2, SB 19, Senator Wolk. And we're going to start as a subcommittee since we don't yet have a quorum. Once I notice a quorum, we will call the roll and establish a quorum. Whenever you're ready, Senator Wolk.
In 2008, I authored AB 3000, which created and authorized the California Physician's Orders for Life-Sustaining Treatment, the POST form. It is a standardized form that ensures that a patient's wishes are honored regarding medical treatment at the end of life. SB 19 establishes the California POST statewide registry within the Health and Human Services Agency to secure an electronic record of a person's POST orders. The POST form is frequently lost and not easily transmitted between healthcare settings in an emergency. This often results in unwanted and aggressive and costly care. In April of this year, the California Healthcare Foundation conducted a study assessing the readiness for an establishment of a POST registry in California, and they found that it would be feasible. Having the POST forms available through a registry would make it possible for medical personnel to quickly access the form and honor the patient's wishes. With me today is Judy Thomas, Executive Director of the Coalition for Compassionate Care in California, Dr. Carrie Ann Drenton, Emergency Physician, and Tim Leslie, President and CEO of Blue Path Health, that will testify in support of the bill. SB 19 has received unanimous bipartisan support. I thank you and respectfully ask for your aye vote.
Good afternoon, members of the committee, Mr. Chair. I'm Judy Thomas with the Coalition for Compassionate Care of California. We're the lead for POST in the state of California, and it is a form that helps people to think about and document their wishes in the face of serious advanced illness. It is all about honoring people's choices for whatever care they want, whether it's full aggressive measures or more palliative approach. A registry is the next logical step for our POST program here in California, which has been very successful and is well penetrated throughout the state. I urge your aye vote.
Witnesses in support.
Hello, my name is Carrie Ann Drenton. I'm an emergency physician here in Sacramento, actually, at Sutter General, Sutter Memorial, and Mercy San Juan. The POST form is an amazing tool that I use on a daily basis for patients that come into the emergency department with a variety of complaints. It allows me to quickly see how aggressive they may or may not want me to be. They're able to change their mind at any time, but if they are unable to give me any direction themselves, it allows me a tool to know what they had wanted before they turned into the state that I see them in the emergency department, and it allows me to avoid any unnecessary suffering or futile procedures that might just make their suffering prolonged. It's a wonderful tool, and I strongly urge your aye vote.
Thank you. Noticing a quorum, Madam Secretary, please call the roll.
Bonta?
Here.
Mainshine? Here. Bonilla? Burke? Chavez? Here. Chu? Here. Gomez? Gonzalez? Present. Hernandez? Lackey? Here. Nazarian? Patterson? Ridley Thomas? Rodriguez? Here. Santiago? Steinnorth? Here. Thurmond? Waldron? Here. Wood? Here.
A quorum is present. Please excuse the momentary departure. Please proceed.
Hi, I'm Timmy Leslie, President of Blue Path Health, and I conducted the feasibility study with my team for the California Healthcare Foundation for the POST registry. We conducted a number of interviews. We heard overwhelming support from payers, providers, and from patients. I urge you to vote yes.
Additional witnesses in support.
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Emergency Physicians, in support.
Additional witnesses in support.
Chair and members, Luis Sanchez on behalf of Blue Shield of California, in support.
David Ford on behalf of the Alliance of Catholic Healthcare, in support.
Michael Toe with Providence Health and Services, in support.
Greg DeGio with the ARC and United Cerebral Palsy California collaboration and support, and we also hope it is possible to expand it to include we hope it might be possible to expand it to include the advanced healthcare directives.
Thank you. Seeing no witnesses, additional witnesses in support, witnesses in opposition.
Ready? I'm Mike Hodis, Turnout, California. I'm opposed to this bill unless there are protections that are given for patients in hospitals. It should not be used as a reason to euthanize a patient in the hospital, as it was with my wife. They used her as DNR, and that's what they repeated. She never needed to be resuscitated.
Okay, additional witnesses in opposition?
I'm Stan Dundon, and I'm a bioethicist, and I've done an extensive study of this bill. I sit on a couple of hospital ethics committees, and we really like the POLST in many cases, but the fact of the matter is it ages rather quickly. A doctor is supposed to carry out the interviews, although they allow nurses to do it. I feel that it's a little premature, actually. It needs some heavy work, which I'd be willing to help the author with.
Thank you, sir. Additional witnesses in opposition? Seeing none, questions or comments from members, and we can also entertain a motion. We have a motion, we have a second. Assemblymember Rodriguez.
Question. So, yeah, just a quick question. I'm looking to support the bill, but so would this be something in conjunction to a DNR, correct? Or a little bit more meat, so to speak, more information?
POLST is similar to a DNR order, which is also a medicals order, but and it has 3 sections, A, B, and C. Section A is a DNR, or you can indicate that you want them to attempt resuscitation. So unlike DNR, you can say you want them to attempt it. But it has other treatment choices as well, so that it's not misinterpreted that if you choose DNR, they don't assume what your other choices are. It's on the form.
Good. And just another question, too, because obviously in some of these situations occur, they're at home, and when things go bad, so to speak, they're calling 911. You get all the emergency responders there, and if there's a change or whatnot, we need that information. So that'll be also there, obviously at home with the patient, so that way if something were to occur, they do call 911, that's accessible, just like a DNR, correct?
Correct. Because it's a physician's order, emergency responders can honor it.
Okay, that's my only question. Thank you.
Additional comments or questions from members? We have a motion. We have a second. Senator Wolk, would you like to close?
I would just ask for your aye vote and thank the staff and the chair for assisting us in this bill. Thank you. And your suggestions, actually, which we will follow.
Thank you, Senator Wolk. The motion is due pass to judiciary. We have a motion. We have a second. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Burke? Chavez? Chavez, aye. Chu? Chu, aye. Gomez? Gonzalez? Gonzalez, aye. Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Steinnorth? Steinnorth, aye. Thurmond? Waldron? Waldron, aye. Wood? Wood, aye.
The bill passes 11-0.
Thank you very much, Mr. Chair and members.
Thank you, Senator Wolk. As a reminder to those watching and members who are members of the public who are here presently, SB 128, at the request of the author, was removed from today's agenda. Next, we are going to item number 3, SB 33. Chair Hernandez. Mr. Chairman, whenever you're ready.
Thank you very much, members and chair. This bill, SB 33, currently the Department of Healthcare Service collects from estates of deceased Medi-Cal beneficiaries for services they received after they turn the age 55. As you know, this is called estate recovery and is a deterrent to enrollment in Medi-Cal and is unfair to low-income individuals who need Medi-Cal for basic health care services. This bill would limit Medi-Cal estate recovery to only what is required by federal law. It would also require that the state to adopt a hardship exemption that would exempt a home of modest value from estate recovery. This bill will also make it easier for individuals to find out what Medi-Cal has spent on their behalf. Now, members, keep in mind, California is one of the very few states that goes above and beyond what federal government requires. And I found out about this when I had individuals that were signing up for Covered California and our Medi-Cal, and they were concerned that their house was going to be taken away from them. Federal government requires only for long-term care, but in many instances, let's say somebody is 55, they get on Medi-Cal, have no health problems whatsoever, that even the amount of money that they take out every month until they die they're going to be taken after. They're going to go after that particular amount, and they're going to put a lien on their house, and they're going to do it through their estate. The other problem that patients and consumers are having is finding out what that dollar amount is, and this bill would address that. So with that, members, I respectfully ask for an aye vote, and I have individuals like to speak on its in support and behalf.
Thank you, Mr. Chair. Witnesses in support.
Good afternoon, Chair, members. My name is Linda Way with Western Center on Law and Poverty, proud co-sponsors of this important measure. Now that people are required to have health insurance, this remains a critical equity issue, as only the poorest Californians, those on Medi-Cal, are subject to estate recovery. Those with higher incomes who receive subsidies on Covered California are not subject to estate recovery. Estate recovery remains an enrollment barrier for Medi-Cal. We've heard from many low-income consumers who have modest homes and with multiple generations who would rather forego having health insurance rather than risk losing the family home. To be clear, this bill does not eliminate estate recovery. The state can still recover for long-term services such as nursing care, but not for basic health services. A similar bill has passed last year with bipartisan support and no votes, and so we urge the same.
Good afternoon, Mr. Chair and members. Sawait Sium on behalf of Health Access California. We are the statewide healthcare consumer advocacy coalition. We are very much in support of this bill. The message we send with existing policy is really to ask people to choose between their health and their home. California has invested millions to encourage savings and home ownership, as well as to encourage Californians to get coverage under the Affordable Care Act. But this policy, even when it actually impacts so few and yields so little money, it influences millions by undermining those messages of responsibility in terms of savings, home ownership, and health coverage. For these reasons, we ask for your support.
Thank you. Additional witnesses in support?
Kimberly Chen with the California Pan-Ethnic Health Network. Low-income Californians shouldn't have to choose between health care and the possibility of losing their home, and we're in support. Thank you.
Did I hear a second? We have a motion. Did I hear a second? Okay. Assemblymember Santiago. Additional witnesses in support.
Greg DeGier with the ARC and United Cerebral Palsy California Collaboration, the Developmental Disabilities Coalition. Adults with developmental disabilities overwhelmingly have poverty-level incomes. This is an important and rely on Medi-Cal, and this is an important bill for us. Thank you.
Good afternoon, Jennifer Gabals with the California Association of Health Plans, also in support.
Dave Walrath, representing California Retired Teachers Association, in support.
David Gonzalez on behalf of CAPCHI, happy to be here in support. Our provider is responsible for the care of some 18 million Californians, and happy to be here in strong support.
Mr. Chair and members, Noep Adamo, representing California Rural Legal Assistance Foundation, in support.
Rocio Gonzalez on behalf of the Latino Coalition for Healthy California, in support.
Kathy Sunderling with McDonald with the County Welfare Directors Association, in support.
Farrah McDade-Ting with the California State Association of Counties and also on behalf of the County Health Executives Association of California in support.
Michelle Cabrera with SEIU California in support.
David Ford for the Private Essential Access Community Hospitals in support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Dolores Duran Flores with the California School Employees Association in support.
Taffy Ruzicka on behalf of 3 million people of AARP members. We're in support.
Kristen Jacobson, Autism Deserves Equal Coverage in support.
Chair and member Sean South on behalf of the California Primary Care Association in support.
Thank you. Seeing no additional witnesses in support, witnesses in opposition. Seeing none. Questions or comments from committee members? Assemblymember Ridley Thomas.
Yes, Senator. The analysis mentions whether or not the 7% ceiling is appropriate. You open to lowering it. Was there a particular reason? Is it consistent with other programs?
I think that's a maximum. Maybe I can have
maximum. Yeah, but lowering.
Maybe the sponsors kind of address that as well.
Okay.
Certainly. So what it would do is tie it to the surplus money fund or a max of 7%. I don't know of any bank currently or any private interest that charges 7% annually, and so 7% is quite high, and so that is a ceiling.
Right. So my question is just based on what was in the analysis and having read the bill about lowering that. Is that all right in terms of the ceiling? In the event that interest rates do increase, that's what I'm asking. Are you open to lowering the ceiling?
There's been no amendments proposed. The chair hasn't proposed any amendments. At this point, I'm not willing or prepared to do that.
All right. It was just mentioned in the analysis, so I didn't hear it mentioned. The other question I have is, if you don't mind me asking,
I
Senator,
do.
It's all right.
But I'll answer anyway.
You'll forgive me. You'll forgive me. I think that when it was vetoed last year or the year before, there was a question about cost. Has that been arrested or changed?
Nope. There's still going to be question of cost. Okay. So you ran the bill last year. I don't know if those of you who are new members who obviously weren't here. It's bipartisan support. There was a veto message. The administration showed an interest to have a discussion during the budget. We didn't have that discussion. I think it's a righteous cause. I brought it back. If it get vetoed again, I'll have that discussion in the budget as well. But here's the reason why I think it's so important. So if an individual is at below 134% or 130% of poverty level, they're on Medi-Cal. They're required to take Medi-Cal. If they choose not to purchase or be on Medi-Cal and go into Cover California the open market, they get absolutely no subsidies whatsoever. They have to pay the full cost of that health care. Somebody who's above 138% of poverty level goes into Cover California and gets most, if not the maximum amount of subsidy from the federal government. But yet, they're not going to be required to pay back that subsidy, and their house is not going to get attached once they pass. So I think this is an inequity, especially when you're dealing with poor people. And that's why I'll continue to bring this bill back until the governor either signs it or we have some kind of resolution in the budget.
Thank you, Senator. Thank you, Mr. Chairman.
Thank you, Assemblymember. Assemblymember Chavez.
Yes, Senator Hernandez, as you know, we have 8 different veteran homes in the state, and when the veterans pass on, part of the procedure is to recover from their whatever resources they have. Is this going to impact the financial viability of the Veteran Homes Program?
I don't know. I don't have the answer to it, but if it's a veteran that's on Medi-Cal, they would go after their asset as well. So I can get that answer to you, but I don't have that answer.
That would be my only concern. I understand what we're trying to do. I just wanted to show a wrinkle in it that it may be impacting the Veteran Home Program we have, and if there's some way, if there's language in here that could protect that, then I would.
Yeah, I don't have that answer for you.
Thank you.
Seeing no more Questions or comments from members of the committee? Mr. Chair, would you like to close?
Just respectfully ask for an aye vote, Mr. Chair and members, and thank you very much for your time and consideration.
Thank you, Mr. Chair. We have a motion. Due pass to appropriations. We have a second. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Chavez? Chavez, no. Chu? Chu, aye. Gomez? Gonzalez? Gonzalez, aye. Hernandez? Lackey? Lackey, aye. Nazarian? Patterson? Patterson, aye. Ridley Thomas? Ridley Thomas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Stein North? Stein North, aye. Thurman? Thurman, aye. Waldron? Waldron, aye. Wood? Wood, aye. I'm sorry, 15-1.
Mr. Chair, your bill passes with a vote of 15 to 1.
Thank you very much.